Hi, my name is Randy Beckett. I'm a psychiatric mental health nurse practitioner and a family nurse practitioner. And I'd like to talk to you about a very important subject for older people. Okay. And that is pain and how it relates to anxiety, depression, and cognition. So I've been doing this quite a while, but one gentleman really sticks out in my mind. He was 80 something years old and he had terrible behaviors, very cognitively impaired, and terrible behaviors was just, lashing out, resisting cares, trying to hit staff, just, just not doing well at all. And the primary care provider couldn't figure out what was going on. And I couldn't figure out what was going on. Nothing seemed to be working. And finally, he had a routine visit to a dentist, and he had an infected tooth that had to be extracted. It was very inflamed, very infected, and it obviously was painful to him, but he could not tell us that his tooth was hurting. The tooth was extracted, and after normal recovery time, he was great. So pain can cause anxiety. If you've had back pain and you're trying to do something and you know how it feels and how anxious you can get, it can cause depression, uh, where your mood changes and you just feel tired. Maybe you're not sleeping properly because the pain is taking awake, or you're anxious and your mind is going a million miles a minute while you're lying in bed. And these things are very serious, and they're particularly serious for the elderly, especially those people who have cognitive deficits that have a hard time relating to you, specifically their pain and where it's coming from. They can't ask for PRN pain medication due to communication deficits. It's really a problem. And also, pain affects cognition rather dramatically. When people are in pain, it affects their memory and their ability to function, because it's this noxious stimuli into the brain that just takes over. And I mean, you probably had the same thing happen to you too. You're in pain, or you have a headache, or your back hurts, or shoulder hurts, and you just have a hard time focusing. So the elderly population is very susceptible to pain impairing their cognition. So we have to be very, very aware of, just because somebody has a a diagnosis of depression or anxiety or bipolar disorder or even schizophrenia or dementia, that we take into consideration when we're evaluating them and assessing them, that pain may be an issue for them. Because oftentimes when somebody has a specific diagnosis, we just, well, he or she, they have depression anyhow, or they have anxiety, or they have a diagnosis of dementia, and kind of lose sight or just fall back on that diagnosis rather than entertaining the idea that they may be in pain. And don't forget neuropathic pain with patients who are diabetic, which is often kind of vague and hard to describe. Cancer pain, which can be, of course, very painful. And just chronic pain from hip or back or joint degeneration that's always there. So let's add that to our assessment, and because it's often easy to forget. Now, conversely, depression and anxiety can cause pain. So this kind of complicates the issue because we have to look at what their mood is and how that might be affecting their reports of pain. For example, somebody who has could have somatic body delusions or even hallucinations that they're having pain in a certain area. And sometimes, they may have been worked up, as we say, till the cows come home, and we haven't been able to find anything, but they still have these complaints of pain, which can be related to depression or anxiety. And also certain types of anxiety, like obsessive compulsive disorder, is people can laser focus on something that they think is having pain, a part of their body is having pain, and it's actually due to their compulsions and obsessions more about this particular area that may be the reason for their pain. So that's why it's so important that nursing, all your staff, primary care providers, specialty providers, and your psychiatric mental health nurse practitioner or psychotherapist all think about this. And it's very appropriate for the psychotherapist or the psychiatric mental health nurse practitioner to ask for additional assessment by the primary care provider, or, as I told you in my earlier story, by a dentist, to try to discover what may be causing the pain, or once again to look at these and say, well, there's nothing we can find, this may be related to a mental health disorder. So it takes a lot of coordination. This is not easy work. If you've had chronic pain, I have a shoulder problem that I absolutely know can be related to stress and anxiety, or headaches related to stress or anxiety. You know how the two can intertwine. So it's not just enough to say, can you rate your pain on a scale of 0 to 10, or use the little faces that we use to analyze what somebody's pain level is, but to think about what might be causing this patient's decreased cognition or increased depression or increased anxiety or increased pain. Could it be coming from a mental health disorder? So just take that into consideration, just a little reminder, because I sometimes forget these things too, and it's helpful to have a reminder to see what we kind of get used to without addressing things. And so it's good to have a little reminder, oh yeah, because oftentimes I found that when I read something or watched a video, or very soon after that, I have encounter a patient that has this exact problem. So especially now that you've watched this and read this, or watched this, I'm sorry, listen to it, be aware that a patient might be in your near future who is having pain problems related to mental health, or mental health problems related to pain. Thank you very much for watching.